Hi everyone, and welcome back to the course. If you're new here, my name is Georgina, and this series is all about understanding endometriosis in a clear, honest, and actually helpful way, without all the confusion, dismissal, or oversimplification that so many people run into. This is course 2, and today we're focusing on something that sounds simple on the surface, but is actually one of the most misunderstood parts of this condition: symptoms, and more importantly, how they actually show up in real life. Now, you might be thinking, symptoms? Isn't that just pain and heavy periods? And that's exactly the problem. Because for a long time, that's all many people are told. But the reality is, endometriosis symptoms are often complex, overlapping, misleading, and in many cases, completely dismissed. So, what I want to do in this video is go way beyond a basic checklist. We're not just going to list symptoms, we're going to talk about what they actually feel like, how they can change over time, why they don't always make obvious sense, and why so many people don't realise what's happening in their own body. Because one of the biggest reasons endometriosis goes undiagnosed for so long is this: people don't recognise their own symptoms as serious enough. They normalise them, they push through, they adapt their lives around pain, fatigue, or discomfort, and it becomes their version of normal. So before we go any further, I want to say something really clearly. If you've ever felt like your symptoms are being minimized, if you've ever been told it's just a bad period, or if you've started questioning your own experience, you're not alone. And what you're feeling is worth understanding. Now, another important thing to keep in mind as we go through this video: there is no single way that endometriosis shows up. Two people can have the same condition and experience it in completely different ways. One person might have severe pain every single month. Another might have mild symptoms but struggle with fertility. And someone else might have digestive issues, fatigue, and back pain, and never even connect it to their reproductive system at all. That's why this video is going to be quite detailed, because the goal here isn't just awareness, it's recognition. I want you to be able to hear these symptoms and think, okay, I understand what that actually means. Not just medically, but practically. What it feels like, what it looks like in daily life, and how it can affect everything from your energy levels to your relationships. We're also going to talk about something that doesn't get discussed enough: the pattern of symptoms. Because it's not always about one symptom on its own. It's often about when symptoms happen, how they connect to your cycle, and how they build up over time. And once you start seeing those patterns, things can start to make a lot more sense. Now, just a quick note before we begin. This video is for education and awareness. It's not a diagnosis. But if you do recognise yourself in what we're talking about today, that's vulnerable information. And it might be worth taking that forward, whether that's tracking your symptoms more closely or speaking to a medical professional. Also, I want to acknowledge that some of what we talk about in this video might feel validating, but it also might feel a bit overwhelming. And that's completely normal. Take it at your own pace. Pause if you need to. Come back to sections later. There's no rush to process everything all at once. Alright, so with that said, let's start breaking this down properly. Let's talk about what endometriosis symptoms really are and why they can be so difficult to recognise in the first place. Section 1. Why endometriosis symptoms are so confusing. Alright, so before we start going through specific symptoms, we need to talk about something that sits underneath all of this. And that is why endometriosis symptoms are so confusing in the first place. Because once you understand this part, everything else starts to make a lot more sense. One of the biggest misconceptions about endometriosis is that it follows a clear, predictable pattern. That if you have it, you'll experience severe period pain, heavy bleeding, and obvious monthly symptoms. But in reality, that's not how it works. There is no single standard experience of endometriosis. Two people can both have confirmed endometriosis and have completely different symptoms. For example, one person might experience debilitating pain that stops them from going to work or school, symptoms that clearly follow their cycle, and obvious worsening over time. While another person might experience mild pain, symptoms that don't seem connected to their period, or even no pain at all, but difficulty getting pregnant. And both of those experiences are valid. Both can be endometriosis. Symptoms don't always look gynecological. Now, this is a big one. A lot of endometriosis symptoms don't obviously point to the reproductive system. Instead, they can show up as digestive issues, fatigue, lower back pain, bladder problems. So what often happens is that people go to different doctors for different symptoms. They might see a GP for fatigue, a physiotherapist for back or hip pain, and no one is necessarily connecting the dots, because on the surface, those symptoms don't seem related. But in the context of endometriosis, they can all come from the same underlying issue. Another reason symptoms vary so much is that endometriosis tissue doesn't grow in just one place. It can be found on the ovaries, around the uterus, behind the uterus, on the bowels, on the bladder, and along ligaments in the pelvis. And in more complex cases, even outside of the pelvic area. Now, why does this matter? Because where the tissue is located influences what you feel. For example, if endometriosis is affecting the bowels, you might experience pain during bowel movements, bloating, constipation, or diarrhea. If it's affecting the bladder, you might notice urgency, frequency, or discomfort when urinating. If it's near certain nerves, you might feel pain that radiates into your legs, lower back pain, or deep pelvic pain that is hard to pinpoint. So, instead of one clear symptom, you can get a range of experiences that can seem unrelated. Not all endometriosis tissue behave in the same way. Some lesions are small and superficial. Others are deep and infiltrating into the surrounding tissue. And you might assume that deeper or more widespread disease always mean worse symptoms, but that's not always true. Some people with extensive endometriosis have relatively mild symptoms, while others with less visible disease experience intense pain. This mismatch is one of the reasons diagnosis can be delayed, because symptoms don't always reflect what's physically visible. Endometriosis isn't just about tissue being in the wrong place. It also triggers an ongoing response in the body. This includes inflammation, immune system activity, irritation of surrounding tissues. And this is important because inflammation can affect nerves, organs, and muscles, which means symptoms can feel very different from one moment to the next. The pain might be sharp and sudden, dull and constant, burning or radiating. And sometimes it's not even clearly pain. It might be pressure, heaviness, or a general sense that something isn't right. Endometriosis is often described as a hormone-driven condition. This is why many people expect symptoms to only happen during their period. But in reality, it's not always that simple. Some people do experience pain mainly during their period, but others notice symptoms before their period starts, around ovulation, or throughout the entire month. And over time, symptoms can shift. What starts as period pain might become more frequent, less predictable, or constant. So, if you've ever thought, this doesn't line up exactly with my cycle, so it can't be related, that's not necessarily true. The role of the nervous system. This is something that doesn't get talked about enough. When pain is repeated over time, the nervous system can become more sensitive. This means the body becomes better at detecting pain, but also more reactive to it. So sensations that might not have been painful before can start to feel more intense, more widespread, or longer lasting. This doesn't mean the pain is in your head. It means your body has adapted to ongoing signals and is responding more strongly. Normalization and delay. This is one of the biggest reasons symptoms are confusing. It's not just biological, it's social. A lot of people grow up being told that period pain is normal, discomfort is expected, and it's something you just have to deal with. So when symptoms start, they're often dismissed, minimized, or pushed through. People adapt. They plan their lives around pain. They avoid certain activities. They accept fatigue as part of daily life. And because of that, it can take years to realise that something isn't right. So, when you combine all of these factors, notice that standard symptom pattern. Symptoms that don't always look gynecological. Different locations of tissue. Varying depth and severity. Chronic inflammation. Hormonal influences. Nervous system sensitivity. And normalization of pain. You end up with a condition that is incredibly easy to miss. Not because the symptoms aren't there, but because they don't always look the way people expect them to. Section 2. Pain. What it really feels like. So, now that we've talked about why endometriosis symptoms can be so confusing, let's move into the most well-known symptoms. Pain. But we need to be really clear about something from the start. When people hear pain, especially in the context of periods, it's often minimized. It's seen as normal, expected, something to just get through. And that's where a lot of misunderstanding begins. Because the kind of pain associated with endometriosis is often very different from what people think of as typical period discomfort. So, in this section, we're not just going to say it's painful. We're going to break down the different types of pain, how they feel when they show up, and how they can affect day-to-day life. One of the most important things to understand is that endometriosis pain is not a single sensation. It can feel like sharp stabbing pain, deep aching pressure, cramping that doesn't ease, burning sensations, pulling or tightness, or pain that radiates to other parts of the body. And these can all happen at different times, in different areas, and at different levels of intensity. Sometimes even within the same day. Painful periods. This is often where symptoms begin. But again, this isn't just bad cramps. The difference is in severity, duration, and impact. People with endometriosis often describe period pain as starting days before bleeding begins, increasing in intensity very quickly, not responding well to typical pain relief, and interfering with normal activities. And this might look like missing school or work, being unable to stand upright, needing to lie down for extended periods, or planning your entire schedule around your cycle. Some people describe it as waves of pain that come and go, while others feel consistent, unrelenting discomfort. And importantly, it often gets worse over time. What starts as manageable pain in the early years can become more intense, longer lasting, and harder to ignore. Another key difference is that pain doesn't always stay within the expected window. It can begin several days before a period and continue even after bleeding has stopped. This creates a situation where someone might feel like they're only in pain for a short part of the month, or sometimes not at all. Pain outside of the cycle. This is something that often catches people off guard, because many expect period-related conditions to only cause symptoms during menstruation. But with endometriosis, pain can happen at any point in the cycle, or even constantly. This might feel like a dull ache in the lower abdomen or pelvis, a sense of heaviness or pressure, sudden sharp pains that come without warning. And because it's not tied clearly to a period, it can be dismissed or harder to explain to others. Some people with endometriosis experience significant pain around ovulation. This can feel like sharp localized pain on one side of the lower abdomen, cramping or pressure, pain that lasts longer than typical ovulation discomfort. And again, this can be confusing because ovulation pain is often considered normal. But when it becomes intense, disruptive, or consistent, it's worth paying attention to. Pain during or after sex. This is a very important symptom and one that is often under-discussed. Pain during sex can feel like deep internal pain, a sharp or stabbing sensation, a feeling of hitting something sensitive inside. And for some people, the pain doesn't stop when the moment ends. It can continue as soreness, cramping, or increased pelvic pain afterwards. This can have a significant impact, not just physically, but emotionally. It can lead to anxiety around intimacy, avoidance, strain in relationships, and a sense of isolation. And because it's not always openly talked about, many people don't realise it could be connected to a medical condition. Pain with bowel movements. This is another symptom that often gets misattributed, especially if it overlaps with digestive issues. Pain with bowel movements can feel like a sharp stabbing pain deep in the pelvis, a pulling or pressure sensation, pain that worsens during your period. And for some people, this leads to avoidance, anxiety around using the bathroom, pain with urination. Similarly, pain when urinating can occur, particularly if endometriosis is affecting areas near the bladder. This might feel like burning, pressure, or deep pelvic discomfort. And again, it's often mistaken for urinary tract issues, especially if it comes and goes. Endometriosis pain isn't always limited to the pelvis. Because of nerve involvement, it can spread. Some people experience persistent lower back pain, hip discomfort, pain that travels down the legs. This can sometimes feel like sciatica, muscle strain, or posture-related pain, which can lead people to seek treatment in completely different areas without realizing the underlying cause. The pattern of pain. Now, let's zoom out for a moment, because one of the most important things about endometriosis pain isn't just the type, it's the pattern. You might notice that pain follows certain times in your cycle, builds gradually over months or years, appears in multiple areas of the body, or becomes more frequent over time. And when you start to track that pattern, it can reveal connections that weren't obvious before. Pain isn't just a physical sensation. It affects how you live. For many people, this looks like cancelling plans at the last minute, struggling to concentrate at work or school, planning activities around safe days, carrying medication everywhere, or constantly thinking ahead to manage symptoms. And over time, this can become exhausting, frustrating, and isolating. One of the most difficult parts of this experience is how often pain is dismissed. People are often told, that's normal. Periods are supposed to hurt. You just have low pain tolerance. And when you hear that enough times, it can make you question your own experience. But here's something important to remember. Pain that interferes with your ability to live your life is not something you should have to just accept. So, when we talk about pain in endometriosis, we're not talking about one symptom. We're talking about a wide, shifting, and often unpredictable experience that can include severe period pain, pain outside of the cycle, pain during ovulation, pain with sex, pain with bowel movements or urination, and pain that radiates through the back, hips, and legs. And all of this can vary from person to person, from month to month, and over time. Section 3. Bleeding. What changes and why it matters. So, now that we've taken a detailed look at pain, let's move into another major area of symptoms. Bleeding. And just like with pain, this is often simplified down to one idea: heavy periods. But the reality is much more complex than that. Because changes in bleeding don't always look dramatic. They don't always match the level of pain someone is experiencing. And in many cases, they're either dismissed as normal or not recognised as significant at all. So, in this section, we're going to break down the different ways bleeding can change, what those changes might look like in real life, and why they don't always follow a predictable pattern. Before we get into specifics, it's really important to say this: not everyone with endometriosis has heavy or abnormal bleeding. Some people have very painful periods, but completely normal bleeding. Others have noticeable changes in bleeding, but less pain. And some experience both. So, if you're listening to this and thinking, my periods don't seem that heavy, that doesn't rule out anything. Bleeding is just one part of a much bigger picture. Let's start with the most commonly discussed symptom in this category: heavy periods. But what does heavy actually mean? Because it's often described in vague terms. In practical, everyday terms, heavy bleeding might look like needing to change pads or tampons very frequently, bleeding through protection unexpectedly, having to double up on products, waking up during the night to manage bleeding, avoiding certain clothes or activities during your period. It can also include passing blood clots, periods that feel difficult to manage or control. And importantly, it's not just about volume, it's about impact. If your period is disrupting your sleep, limiting your movement, or causing constant stress about leaking, that's significant. Beyond the practical side, heavy bleeding can also feel draining, overwhelming, difficult to keep up with. Some people describe a sense of loss of control, anxiety about leaving the house, or constantly needing to plan ahead. And over time, this can become physically exhausting, mentally tiring, and emotionally frustrating. Another pattern that can show up is periods that last longer than expected. Instead of bleeding for a few days, some people experience periods that continue for a week or more, lingering spotting before or after the main flow, a sense that the cycle never fully ends. This can blur the boundaries between period, pre-period, and post-period phases, making it harder to track patterns clearly. Now, for some people, bleeding doesn't follow a predictable schedule at all. This might include cycles that are shorter than expected, cycles that are longer or inconsistent, periods that arrive unpredictably, or it could be spotting between periods. And this unpredictability can make it difficult to plan ahead, track symptoms, or recognize patterns. Spotting is often overlooked because it can seem minor, but it can still be an important piece of the overall picture. This might look like light bleeding between cycles, unexpected spotting at different times of the month, bleeding that doesn't seem to follow a clear pattern. And while spotting can have many causes, when it appears alongside other symptoms, it can be worth paying attention to. Some people might notice changes in the way their bleeding appears. This can include passing clots, flow that varies significantly from day to day, sudden increases or decreases in bleeding. These changes can feel unpredictable, difficult to manage, or concerning if they're new or worsening. When bleeding and pain don't match. This one This is one of the most confusing aspects of endometriosis symptoms, because we often expect more bleeding, more pain, less bleeding, less pain. But that's not always the case. Some people experience severe pain with relatively light bleeding, while others have heavy bleeding with less intense pain. And this mismatch can lead to symptoms being dismissed, or people questioning whether what they're expecting is serious enough. Bleeding patterns are influenced by hormones, and because endometriosis is hormone responsive, this can affect timing, flow, and consistency of periods. This is why some people notice that their bleeding changes over time, becomes heavier or more irregular, or shifts in response to hormonal treatments. Just like with pain, bleeding isn't just about individual symptoms. It's about the overall effect over time. Managing ongoing changes in bleeding can lead to fatigue, stress, disruption to daily routines, and a constant need to plan ahead. It can also affect how someone feels in their body, physically, emotionally, and socially. One of the reasons bleeding symptoms are often overlooked is that there's a wide range of what's considered normal. People are often told everyone's period is different. Some people just have heavy periods. And while that is true to an extent, it can also lead to important symptoms being dismissed, especially if they develop gradually or have always been present. So, when we talk about bleeding in endometriosis, we're not just talking about heavy periods. We're talking about a range of possible changes, including heavy or difficult to manage flow, long-lasting periods, irregular cycles, spotting between periods, changes in flow or clotting, and patterns that don't always match the level of pain. And just like with pain, these experiences can vary from person to person, over time, and in combination with other symptoms. Section 4. Digestive symptoms, when it doesn't seem gynecological. So now we're moving into a category of symptoms that causes a lot of confusion and often a lot of misdiagnosis. Digestive symptoms. And this is where many people start to feel like something's wrong, but I don't know what it is. Because the symptoms don't obviously point to a gynecological condition. Instead, they often look like gut issues, food sensitivities, or general digestive problems. And because of that, people are frequently diagnosed with other conditions first, treated for the wrong thing, or told that it's just something they have to manage. So, in this section, we're going to break down what these symptoms actually look like, why do they happen in endometriosis, and how they can show up in everyday life. Let's start with the why, because this helps everything else make sense. Endometriosis can affect areas close to or directly involving the digestive system. This includes the bowels, the rectum, the surrounding pelvic structures. And even when it's not directly on those organs, inflammation in the area can still have an effect. So what you end up with is irritation, pressure, and disruption in how the digestive system feels and functions. And because the gut and nervous system are closely connected, this can also influence sensitivity, pain perception, and how your body responds to normal digestive processes. One of the most confusing things about these symptoms is that they don't always feel like typical digestive issues. Instead of just stomach discomfort, they might feel like deep pelvic pain, pressure in the lower abdomen, cramping that doesn't seem connected to food. So it's not always obvious that the digestive system is involved. Let's start with one of the most commonly reported symptoms: bloating. This isn't just mild or occasional bloating. This is often described as sudden and noticeable swelling of the abdomen, a feeling of tightness or pressure. The stomach appears significantly larger within a short period of time. Some people describe it as looking several months pregnant by the end of the day, or having clothes that fit in the morning but not later on. And what makes it even more frustrating is that it can be unpredictable, unrelated to what you've eaten, and difficult to relieve. Beyond the physical sensation, bloating can also feel heavy, uncomfortable, restrictive. It can affect how you move, how you sit, and how comfortable you feel in your own body. And over time, it can also impact confidence, clothing choices, and daily comfort. Another common pattern is changes in bowel habits. This can include constipation, diarrhea, or alternating between the two. And often these changes worsen during your period or follow a pattern, but not always. Some people experience these symptoms throughout the month. This makes it harder to connect them to a hormonal or gynecological cause. Because of these symptoms, many people are initially told they have irritable bowel syndrome, or IBS. And while IBS can absolutely exist on its own, in the context of endometriosis, these digestive systems may actually be a response to inflammation or irritation from nearby endometrial-like tissue. This overlap is one of the reasons diagnosis can take so long. For some people, eating itself becomes uncomfortable. This might feel like cramping after meals, pressure building in the abdomen, a sense of fullness that feels excessive or painful. And this can lead to avoidance of certain foods, anxiety around eating, or confusion about what's triggering symptoms. Nausea is another symptom that doesn't always get linked back to endometriosis. This can show up as a constant low-level feeling of nausea, waves of nausea during pain flares, or nausea that worsens during your period. And while it might not always lead to vomiting, it can still be disruptive, uncomfortable, and difficult to manage. We touched on this briefly in the pain section, but it's worth revisiting here in more detail. Pain during bowel movements can feel like sharp stabbing pain deep in the pelvis, a pulling sensation, or intense discomfort that makes you tense up. This often becomes more noticeable during your period, and over time it can lead to avoidance, anxiety, or changes in routine. Some symptoms don't fit neatly into one category. Instead, they show up as excess gas, abdominal pressure, a general sense of discomfort in the digestive system. And while these might seem minor on their own, when they happen frequently or alongside other symptoms, they become part of a larger pattern. One of the biggest clues that digestive symptoms may be linked to endometriosis is timing. You might notice that symptoms worsen before or during your period, improve afterwards, or follow a repeating monthly pattern. But again, not always. And that inconsistency is part of what makes things confusing. Digestive systems don't just affect the body, they affect how you live. This might look like avoiding certain foods or social situations, feeling uncomfortable in public, planning your day around access to a bathroom, or constantly managing symptoms in the background. And over time, this can become mentally draining, socially limiting, and physically exhausting. When symptoms get dismissed, digestive systems are often dismissed because they're so common in general. People are told it's just something you ate. It's stress. It's normal to have gut issues sometimes. And while those things can be true, they can also mask a deeper issue when symptoms are persistent or happening alongside other signs like pain and fatigue. So, when we talk about digestive symptoms in endometriosis, we're not just talking about occasional discomfort. We're talking about a range of experiences, including significant bloating, changes in bowel habits, painful digestion, nausea, pain with bowel movements, and ongoing abdominal discomfort. And just like everything we've discussed so far, these symptoms can vary from person to person, change over time, and overlap with other conditions. Section 5. Fatigue and whole body effects when it's not just tiredness. So far, we've talked about symptoms that are a bit easier to connect to a physical source. Things like pain, bleeding, digestive issues. But now we're moving into something that can be just as impactful, if not more so, in day-to-day life. Fatigue and whole body effects. And this is an area that is often underestimated, misunderstood, or completely overlooked. Because fatigue doesn't always look dramatic from the outside. It's not always visible. And it's very easy for it to be dismissed as being busy, not getting enough sleep, stress, or just one of those things. But the kind of fatigue associated with endometriosis is often very different from normal tiredness. So, in this section, we're going to break down what this fatigue actually feels like, why it happens, and how it affects the whole body. Let's start with a really important distinction. Fatigue is not the same as feeling tired. Being tired is something that most people can relate to. Fatigue can feel like a deep, ongoing exhaustion, low energy that doesn't improve with rest, a sense that your body just doesn't have the capacity it used to. It's not just, I need a nap. It's more like, I don't have the energy to get through the day I normally would. For many people with endometriosis, fatigue is persistent, unpredictable, and difficult to explain. You might wake up feeling unrefreshed, feel drained even after minimal activity, or hit a wall of exhaustion partway through the day. And this can happen even on days without severe pain, even when you've slept well. Fatigue can affect both the body and the mind. Physically, it might feel like heaviness in your limbs, slower movement, reduced stamina, Mentally, it can show up as brain fog, difficulty concentrating, forgetfulness, trouble processing information. And this combination can make even simple tasks feel overwhelming, slower, or harder than usual. So, why does endometriosis cause this kind of fatigue? There isn't just one reason. It's usually a combination of factors. Endometriosis is associated with chronic inflammation. And inflammation doesn't just affect one area, it affects the entire body. This can lead to a constant drain on energy, a feeling of being physically run down. Pain itself is exhausting. Even if you're not actively focusing on it, your body is still responding to it, managing it, and compensating for it. Over time, this uses up energy. So even low-level ongoing pain can contribute to fatigue, reduced capacity, and burnout. Pain and discomfort can interfere with sleep quality. You might struggle to fall asleep, wake up during the night, or not reach deep restorative sleep. And even if you're in bed for enough hours, the quality of sleep might not be enough to fully recharge your body. Hormones play a role in energy levels. And because endometriosis is hormone responsive, this can affect how your energy shifts throughout the cycle and when you feel more or less capable. Endometriosis doesn't just stay in one place. Even though the condition itself is often located in the pelvic area, its effects can be felt throughout the body. Some people experience general aches and pains, sensitivity in different areas of the body, a feeling of being physically off or unwell. This can sometimes be hard to describe. It's not always a sharp or specific symptom. It's more like a general sense that your body isn't functioning the way it should. There's also evidence that the immune system plays a role in endometriosis. And while this can show up differently for different people, some notice getting ill more often, taking longer to recover from illness, feeling run down more easily. Again, this contributes to the overall picture of fatigue and reduced resilience. Fatigue doesn't exist on its own. It often connects with other symptoms. For example, pain disrupts sleep, leading to fatigue. Fatigue reduces your ability to cope, making pain feel more intense. Digestive issues affect nutrition, impacting energy levels. So it becomes a cycle, and over time that cycle can be difficult to break. Fatigue can be one of the most limiting symptoms in everyday life because it affects productivity, focus, motivation, physical ability. And this might look like struggling to get through a full workday, needing more rest than others, cancelling plans due to low energy, feeling like you're constantly behind or catching up. And because fatigue isn't always visible, it can be difficult to explain to others. Fatigue is one of the most commonly dismissed symptoms. People are often told, you just need more sleep. Everyone's tired. It's probably stress. And while those factors can play a role, they don't fully explain the persistent, ongoing fatigue that doesn't improve with rest and occurs alongside other symptoms. Living with ongoing fatigue can also affect how you feel about yourself. It can lead to frustration, guilt for not being as productive, feeling like you're letting people down, or comparing yourself to others who seem to have more energy. And over time, that can take a toll on confidence, mental health, and overall well-being. So, when we talk about fatigue in endometriosis, we're not just talking about occasional tiredness. We're talking about deeper, more persistent experience that can include chronic exhaustion, brain fog, reduced physical and mental capacity, whole body discomfort, and a cycle of symptoms that reinforce each other. And just like everything else we've covered, this can vary from person to person, change over time, and exist alongside other symptoms. Section 6. Fertility and reproductive impact. Understanding the connection. So now we're moving into a topic that is often one of the most emotionally loaded parts of endometriosis. Fertility and reproductive impact. And before we go any further, I want to say something really clearly. Having endometriosis does not automatically mean you are infertile. And just as importantly, not having fertility issues does not mean you don't have endometriosis. There is a wide range of experiences here. Some people with endometriosis conceive without difficulty. Others experience delays or challenges. And some only discover they have endometriosis during fertility investigations. So, in this section, we're going to talk about how endometriosis can affect fertility, why the experience varies so much, and what this can look like in real life. One of the most important things to understand is that fertility is influenced by many factors, not just one condition. These include age, hormonal balance, overall health, reproductive anatomy, and timing. And when we talk about endometriosis and fertility, we're talking about a potential influence, not a guaranteed outcome. Endometriosis can impact fertility in several different ways. And again, this depends on location, severity, and how the body is responding. Let's break down some of the main mechanisms. Endometriosis is associated with chronic inflammation, and this can affect the environment where eggs are released, fertilization occurs, and early development begins. This inflammation can disrupt normal processes, affect egg quality, or make implantation more difficult. Over time, endometriosis can lead to the formation of scar tissue, adhesions, which is where tissues stick together. This can affect the position of the ovaries, the function of the fallopian tubes, and how easily the egg and sperm can meet. In some cases, structures that should move freely become restricted or misaligned. When endometriosis affects the ovaries, it can form cysts, often referred to as endometriosis. These can affect ovarian function, impact egg development, or reduce the number of available eggs over time. Endometriosis can also influence hormonal balance, immune system responses, and both of these play a role in ovulation, fertilization, and implantation. So even when everything appears structurally normal, there may still be subtle disruptions in how the process works. One of the most surprising things for many people is that endometriosis can be present without clear symptoms. Someone might have regular periods, minimal pain, no obvious warning signs, and only discover the condition when trying to conceive. This is why endometriosis is sometimes found during fertility investigations, imaging, or surgery. Fertility isn't just a physical topic, it's an emotional one. And when endometriosis is part of the picture, it can bring up uncertainty, fear, frustration, or a sense of loss of control. Even the possibility of fertility challenges can feel overwhelming, especially when there's limited information, conflicting advice, or long wait times for support. Another layer to this is timing. Some people feel pressured to start trying earlier than planned, make decisions quickly, or think about fertility before they feel ready. And that pressure can come from medical advice, external expectations, or internal concerns. For some people, fertility challenges are actually the first sign that something might be wrong. They might try to conceive for an extended period, go through testing, and then discover endometriosis as part of that process. And this can be confusing, especially if they haven't experienced significant pain or other noticeable symptoms. Just like with pain and bleeding, there isn't always a clear connection between severity of pains and fertility outcomes. Some people with severe symptoms conceive without difficulty, while others with mild symptoms experience challenges. And this unpredictability is part of what makes this area so difficult to navigate. Because all of this variation, it's really important to approach fertility in the context of endometriosis as highly individual. Your experience will depend on your body, your symptoms, your medical history, and your circumstances, which is why comparisons can be unhelpful. What happens to one person doesn't determine what will happen to another. Even for those not trying to conceive, the reproductive impact of endometriosis can still matter. It can affect how you think about your future, decisions around family planning, and your relationship with your body. So, this isn't just a clinical topic, it's a personal one. Fertility and endometriosis are often discussed in very simplified ways. You might hear it can cause infertility, but without much explanation. And that lack of clarity can lead to fear, assumptions, or unnecessary anxiety. So having a more balanced understanding is important. So when we talk about fertility and endometriosis, we're talking about a possible connection, not a certainty. A range of physical factors, including inflammation and structural changes, a highly individual experience, and something that can affect both physical and emotional well-being. And just like everything else in this course, it doesn't follow a single predictable pattern. Section 7. Less common and unexpected symptoms when it shows up in surprising ways. So far, we've covered the symptoms that are more widely recognised: pain, bleeding, digestive issues, fatigue, fertility challenges. But endometriosis doesn't always stay within those categories. And this is where things can become even more confusing, because some symptoms don't seem connected at all. They can feel random, unrelated, or difficult to explain. And because of that, they're often overlooked, misdiagnosed, or not linked back to endometriosis at all. So in this section, we're going to explore some of the less common but still important ways endometriosis can show up. Before we go into specific examples, it helps to understand why these symptoms exist in the first place. Endometriosis isn't limited to one exact location. It can affect different areas within the pelvis, surrounding structures, and in some cases, areas beyond the pelvis. It can also interact with nerves, muscles, and nearby organs. So, depending on where it's located and how your body responds, you can end up with symptoms that don't seem obviously connected to a gynecological condition. Shoulder pain. This is one that often surprises people. But in some cases, endometriosis can affect the diaphragm, the muscle involved in breathing. When that happens, it can cause pain in the shoulder, discomfort that feels unrelated to the pelvis, pain that may worsen at certain points in the cycle. And because shoulder pain is usually associated with injury, posture, or muscle strain, it's not often linked back to something like endometriosis. In rarer cases, symptoms can include chest pain, tightness, discomfort when breathing deeply. Again, this is not common, but it does happen. And when it does, it can be confusing, concerning, and often investigated from completely different angles first. We touched on bladder-related pain earlier, but this can also show up as feeling like you need to urinate frequently, a sense of urgency, going to the bathroom more often than usual, even when there's no infection and tests come back normal. This can sometimes be mistaken for recurrent urinary tract issues or bladder sensitivity. Some people experience pain that feels more muscular or joint related. This can include hip pain, pain on one side of the pelvis, discomfort when walking, sitting, or moving. And because it feels like a musculoskeletal issue, people often seek physiotherapy, postural adjustments, or exercise-based solutions, without realizing there may be an underlying internal cause. When endometriosis affects or irritates nerves, symptoms can take on a very different quality. This might feel like burning sensations, tingling, shooting pain, electric-like discomfort, and it may travel along specific pathways, come and go suddenly, or be triggered by movement or position. This kind of pain can be particularly difficult to describe and sometimes difficult to diagnose. One of the more frustrating aspects of endometriosis is that pain doesn't always stay in one place. You might notice pain that shifts from one side to another, symptoms that appear in different areas at different times, or discomfort that seems inconsistent. This can make it feel like there's no clear pattern, or that symptoms are unrelated, but in reality, it can still be part of the same underlying condition. Some people also report increased sensitivity in certain areas of the body, discomfort with pressure or touch, or a general sense of heightened physical awareness. This may be linked to nerve involvement or changes in how the body processes sensation. Even with these less common symptoms, one important clue can be timing. You might notice that they worsen during your period, appear at similar points in your cycle, or follow a repeating pattern over time. But again, not always constantly. And that inconsistency can make them easy to dismiss. Because these symptoms don't fit the expected picture of endometriosis. They're often questioned, dismissed, or attributed to something else entirely. People might hear, "That's not related. It's probably something else. It doesn't fit the typical pattern." And over time, this can lead to doubt, frustration, or feeling like your experience doesn't make sense. This is where it becomes really important to look at symptoms as a whole. Individually, these signs might seem minor, unrelated, or easy to explain away. But when they appear alongside pain, bleeding changes, digestive symptoms, fatigue, they can form part of a larger, more connected pattern. So, when we talk about less common symptoms in endometriosis, we're talking about things like shoulder or upper body pain, chest discomfort or breathing related symptoms, urinary urgency or frequency, hip or side pain, nerve-related sensations, and symptoms that don't move or follow a clear pattern. And while these might not be the first things people associate with endometriosis, they are still valid experiences, and they still matter. Section 8. How symptoms change over time. Understanding progression and patterns. So now that we've explored the wide range of symptoms, both common and less common, we're going to step back and look at something that ties all of this together. How symptoms change over time. Because one of the most important and often overlooked things about endometriosis is that it's not a static condition. It doesn't always stay the same. Symptoms can evolve, shift, increase, or sometimes even temporarily improve. And understanding that can help explain why so many people feel like something has changed, but I can't quite pinpoint when or how. For many people, endometriosis symptoms don't appear suddenly in a clear, obvious way. Instead, they tend to start gradually, build over time, and become more noticeable little by little. In the early stages, symptoms might look like slightly more painful periods than expected, occasional discomfort, mild digestive changes, or fatigue that's easy to dismiss. And because these symptoms are manageable, inconsistent, or explained away as normal, they often don't raise immediate concern. Over time, though, many people notice that symptoms begin to increase in intensity, last longer, or appear more frequently. For example, period pain that used to last a day might start lasting several days. Discomfort that was occasional might become monthly. Symptoms that were mild might become harder to ignore. And this progression can be slow enough that it's not always obvious in the moment. And it's often only when looking back that people realise things have definitely changed. Another common pattern is that symptoms don't just get stronger, they can also become more varied. What starts as period pain might expand to include pain outside of the cycle, digestive symptoms, fatigue, or other types of discomfort. So instead of one clear issue, it becomes a combination of symptoms that seem unrelated, but are actually connected. Symptoms can also shift in terms of when they appear. In the beginning, they might be closely linked to your period, but over time, they might start to occur before your period, after your period, around ovulation, or throughout the entire month. This can create a sense that the pattern isn't as clear anymore, even though there is still an underlying connection. It's also important to understand that progression isn't always linear. Symptoms don't necessarily get worse in a straight line. Instead, many people experience periods where symptoms feel more intense, followed by times where they seem to ease slightly. These fluctuations can be influenced by hormonal changes, stress, lifestyle factors, or treatments. And this can be confusing because it might feel like maybe it's getting better, only for symptoms to return again later. Symptoms can also change during different stages of life. For example, during teenage years, symptoms might first appear as painful periods. In your 20s or 30s, they might become more complex or widespread. Hormonal shifts, such as those related to pregnancy or premenopause, can also influence symptoms. And again, these changes don't follow a single pattern. They vary from person to person. One of the most important and often overlooked aspects of symptoms progression is this: people adapt. As symptoms change, people adjust their lives around them. They might avoid certain activities, plan around their cycle, use coping strategies, or lower their expectations of what feeling well means. And because of that, symptoms can become normalized, less noticeable on a day-to-day basis, or harder to recognize as something that's changed, until something shifts enough to bring it back to focus. Even though progression is often gradual, there are times when symptoms can feel like they've worsened quickly. This might happen when pain becomes more intense, new symptoms appear, or existing symptoms start interfering more with daily life. And this can feel alarming, frustrating, or difficult to explain, especially if these things seemed relatively stable before. Because symptoms can change in so many ways, one of the most helpful things you can do is look at patterns over time. Instead of focusing on one day or one cycle, it can be more useful to notice how symptoms evolve across months or years, whether they're becoming more frequent, whether new symptoms are appearing, and how they're affecting your daily life. This bigger picture often reveals more than any single moment. Understanding how symptoms change over time is important for a few reasons. It helps explain why symptoms might not have seemed serious at first, why diagnosis can take time, and why things may feel different now compared to the past. It also reinforces something important. Just because symptoms were manageable before doesn't mean they always will be. And noticing change is valid. So when we talk about symptom progression in endometriosis, we're talking about a process that can include gradual increase in intensity, expansion into new types of symptoms, changes in timing, periods of fluctuation, and adaptation over time. And all of this can make it difficult to recognize what's happening, especially when changes happen slowly. Section 9. Emotional and mental impact, the part that's often invisible. So far, we focused on the physical side of endometriosis: pain, bleeding, digestive symptoms, fatigue, fertility, and how everything can change over time. But there's another side to this condition that is just as real, and often much harder to talk about: the emotional and mental impact. Because endometriosis doesn't just affect your body, it affects how you feel, how you think, how you see yourself, and how you move through your daily life. And this part is often overlooked, underestimated, or dismissed entirely. So, in this section, we're going to talk about what that experience can actually feel like, why it happens, and why it matters just as much as the physical symptoms. One of the biggest misconceptions is that endometriosis is purely a physical condition. But when you're dealing with ongoing pain, unpredictable symptoms, fatigue, disruption to your routine, it naturally has an impact on your mental and emotional well-being. This isn't separate from the condition. It's part of living with it. Living with recurring or chronic pain can be exhausting, not just physically, but mentally. It can affect your mood, your patience, your ability to focus, your sense of control. Over time, this can lead to irritability, low mood, feeling overwhelmed, and even when pain isn't consistent, the anticipation of it can still be there. You might find yourself thinking, when is it going to start again? Will I be okay tomorrow? That uncertainty can be just as draining as the pain itself. Because symptoms can be unpredictable, many people develop a sense of hyper-awareness, constant monitoring of their body, trying to anticipate or prevent flare-ups. This can lead to anxiety around making plans, leaving the house, being in situations where symptoms might flare. You might start to think, what if I feel unwell while I'm out? What if I can't manage this in public? And over time, that can limit confidence and freedom in daily life. One of the most difficult parts of this experience is how often symptoms are dismissed. People are frequently told it's normal. It's part of being a woman. You're overreacting. And when that happens repeatedly, it can lead to self-doubt, questioning your own experience, feeling like you have to justify your symptoms. You might start to wonder, am I exaggerating this? Is this actually normal? Even when your experience is very real. Because endometriosis can take years to diagnose, many people spend a long time searching for answers, trying different explanations, and not feeling fully understood. This uncertainty can create frustration, confusion, and a sense of being stuck. It's not just about the symptoms, it's about not having clarity. Endometriosis can affect how you live your life in very practical ways. This might include cancelling plans at the last minute, missing work or school, struggling to keep up with responsibilities, planning your schedule around your cycle. And over time, this can lead to feeling unreliable, guilt about letting others down, or pressure to push through even when you're not okay. Symptoms can also affect relationships. This can show up as difficulty maintaining social plans, feeling misunderstood by others, avoiding certain situations, and in more personal relationships, it can affect communication, intimacy, emotional connection, especially if the other person doesn't fully understand what you're experiencing. When symptoms are ongoing and unpredictable, it's easy to start feeling isolated, disconnected, or different from others. You might feel like no one else quite understands. You're the only one dealing with this. Or it's difficult to explain what you're going through, even when you're surrounded by people. A lot of people with endometriosis develop habits of pushing through pain, ignoring fatigue, carrying on despite symptoms. And while that can be necessary at times, it can also lead to burnout, increased symptoms, and a cycle of overdoing it, then needing to recover. There's often an internal pressure to keep up, not fall behind, or not let the condition take over. Over time, living with ongoing symptoms can affect how you see yourself. You might start to feel less confident in your body, frustrated within your limitations, or disconnected from how you used to feel. This can impact self-esteem, motivation, and overall sense of well-being. One of the most powerful things in this experience is being heard and understood. Because when symptoms are acknowledged, taken seriously, and validated, it can make a significant difference in how you feel. Not just physically, but emotionally as well. So when we talk about the emotional and mental impact of endometriosis, we're talking about a wide range of experiences, including the mental toll of chronic pain, anxiety around unpredictable symptoms, the impact of being dismissed or not believed, disruption to daily life, strain on relationships, feeling of isolation, and changes in confidence and self-perception. And all of this is a natural response to living with a condition that is ongoing, complex, and often misunderstood. Section 10. Putting it all together. What this actually looks like in real life. So now we've reached the final section of this video. And at this point, we've covered a lot. We've talked about why symptoms are so varied and confusing, the different types of pain, changes in bleeding, digestive symptoms, fatigue and whole body effects, fertility, less common symptoms, how everything can change over time, and the emotional impact. But now the question is, what does all of this actually look like when you put it together? Because in real life, symptoms don't show up as neat, separate categories. They overlap, they interact, and they shape how someone experiences their daily life. Endometriosis is rarely just one issue. It's not just pain or heavy periods or fatigue. It's often a combination. And that combination might look like waking up already feeling tired, going through the day managing low-level discomfort, experiencing a flare of pain that interrupts everything, dealing with bloating or digestive issues after eating, and then trying to recover while knowing it may happen again. And that's not just during a period. This can be several days a month, or for some people, much more frequent. One of the most challenging parts of this condition is that so much of it is invisible. From the outside, someone might look fine, functional, or completely unaffected. But internally, they might be managing pain, fatigue, discomfort, and constant awareness of their body. And that gap between how things look and how they can feel can be difficult, because it often leads to misunderstanding, unrealistic expectations, or feeling like you have to explain yourself. Alongside the physical symptoms, there's also a mental load that builds over time. This includes tracking your cycle, anticipating symptoms, planning around good days and bad days, managing medication or coping strategies, and constantly adjusting your routine. This isn't always visible, but it takes energy, and over time it can feel like you're always managing something in the background. As we mentioned earlier, people adapt, and this adaptation can become so normal that it's almost invisible, even to the person experiencing it. This might include avoiding certain activities without thinking about it, turning down plans automatically during certain times, structuring your life around your cycle, accepting a lower baseline of energy or comfort. And because these adjustments happen gradually, they can feel like this is just how things are, even when it's having a significant impact. For many people, there comes a point where something shifts. That might be symptoms becoming more intense, symptoms becoming more frequent, new symptoms appearing, or simply reaching a point where it's no longer manageable. And that's often when people start to ask more questions, look for answers, or seek support. One of the most valuable things you can take from this video is pattern recognition. Not just individual symptoms, but how they connect. You might start to notice timing around your cycle, recurring combinations of symptoms, triggers or patterns over time, changes in how your body feels. And that awareness can be a really important step because it turns something that feels random, confusing, or overwhelming into something that starts to make sense. It's also really important to say this. There is no single correct version of endometriosis symptoms. Your experience doesn't have to match someone else's, a checklist, or a textbook description to be valid. Symptoms can be mild or severe, consistent or unpredictable, focused or wide-ranging, and they can still matter. So, if you've been listening to this and recognizing parts of your own experience, what can you do with that? A good place to start is paying attention to patterns, tracking your symptoms over time, noting when things happen and how they feel. This doesn't have to be complicated. It can be as simple as writing things down, using an app, or keeping a mental note. And from there, if needed, you can take that information to a GP, a specialist, or a healthcare provider. Because having a clear picture of your symptoms can make those conversations more productive. So, when you step back and look at the full picture of endometriosis symptoms, what you see is a condition that can affect multiple systems in the body, a wide range of physical and emotional experiences, symptoms that can change over time, and a pattern that doesn't always fit expectations. And that's exactly why understanding it properly matters. So that brings us to the end of course 2. And if you've made it this far, you've covered a really important part of understanding endometriosis. Because symptoms are often where everything begins. They're the first signals, the first signs that something might not be right. And the better you understand them, the easier it becomes to recognize patterns, trust your own experiences, and take the next steps if you need to. If anything in this video stood out to you, it might be worth taking a moment to reflect on it, write it down, or come back and revisit certain sections. You don't have to process everything at once. Now, in the next part of this course, we're going to move on to diagnosis. We'll talk about why it often takes so long, what the process actually involves, and what to expect if you decide to pursue answers. Because understanding symptoms is one step, but knowing what to do next is just as important. If you found this video helpful, you can like the video, subscribe to the channel, and share it with someone who might benefit from it. And as always, thank you for being here. I'll see you in the next one.